Good afternoon, everyone. My name is Karen Moline. I'm the acting superintendent for the Fairbanks School District, and I just want to welcome you to this afternoon's Facebook Live episode. Today we wanted to do a little bit of unpacking of the district's maintaining in-person learning during COVID plan. There's a lot going on now in the world of COVID mitigation and making sure that we can maintain our in-person learning as an option. So today we thought we would just kind of walk through each part of the plan to help add a little bit of clarity, give you some understanding of some of those moving parts. One of the things we want to again reiterate is that this is a fluid plan, just like COVID moving through our environment is. This plan is built to be responsive to what's happening within our community and within our school communities. So at this time, I'm going to invite Assistant Superintendents Luke Meinert and Kate LaPlante to come and just walk us through all of the pieces of that plan.
Hi, I'm Kate LaPlante. I'm the Assistant Superintendent overseeing elementary schools, and I'm here today with...
Hello everybody, I'm Luke Meinert. I'm the Assistant Superintendent overseeing secondary schools.
And it's our pleasure today to introduce you to the Maintaining In-Person Learning During COVID-19 plan, which is our mitigation plan. And we have been kind of revising plans that we used last year, but also updating them to be responsive to where we are this year with our plan. And so for this year, we have 4 different levels, and we're going to walk through this plan with you. And if you want to follow along with us in today's session, there is the full document for the Maintaining In-Person Learning Mitigation Plan on the website, and you can see that at the HTTP, the bit.ly that we have at the top of the screen here. And that's the access to the full document with all the details that we're going to go over in a high level. Today we're going to talk about the district communities, prevention and mitigation, which is kind of where we spend the bulk of our time, modified operations, potential school closures and what might lead to that, and then of course partnering with parents, which is one of the most important things that we do. So again, if you want to follow along, you can find that bit.ly and find the full document. I want to address communities. So we are of course in the Fairbanks community and the borough community, but for the sake of our plans, we're going to look at our school communities and even smaller sections within the school. That might be a classroom, a team, a group of classrooms that trade teachers and things like that. And so a lot of our plans are designed to be school level or even classroom level mitigations. We kind of understand that what might be happening at West Valley or Lathrop might be very different than what's happening at North Pole Middle School or Salcha Elementary School. So we don't want to make a decision that impacts the entire district when really we can make a more focused approach that targets specifically where something might be happening. So for the purpose of our plan, we're talking about the community and we're talking about the very localized communities within the school. Level 1, we're going to talk about prevention, and we're going to live in prevention and mitigation all year long. And so prevention includes things that you do as families and in the community that only you have decisions and authority around, such as vaccinations and choices around face coverings and maintaining your students, your child's health and wellness and deciding whether it's really a good idea for them to come to school today. Those are all things that live with the family. And then there's things that we partner with you, such as physical distancing to the extent possible in the schools, maintaining seating charts in the classroom so that when we have to do contact tracing, we have that kind of information. Daily cleaning and sanitizing. We are doing a high level of that on a regular basis using that electrostatic sprayer that we learned how to use so effectively last year, and also teaching our students about health hygiene, things like respiratory etiquette, hand washing, cleaning high-touch surfaces. So those are all the things that we're doing, and we invite you to participate with us in what we're calling the 3 C's. That's to be cautious, to be courteous, and to be clean. And I think of being cautious as all the things that you do or that I do or that we can do to prevent getting sick to begin with. Being courteous is what we do if we think we might be sick so that we don't spread that to others, and being clean is the things that we do on a regular basis to keep our environment clean. So there's lots of things that fall under being cautious, courteous, and clean. And I think one of the biggest things that I'd like to remind people right now is that it's very courteous to, if you think you might be sick or have any symptoms, or if your child has any symptoms, to keep them home. That's the courteous thing to do. I'm going to talk about level 2, mitigation. One of the biggest things that we have for mitigation right now is the ability, more so than we did last year, to offer some testing. And so we are definitely trying to ramp this up, and we're feeling some growing pains along with that. So if you've experienced that along with us, I apologize, hang in there. We are trying to get to the place where we can offer rapid COVID testing for our students at their school site. And for our staff, we're moving the staff testing location down here to the admin building. We have 2 different types of tests. We have antigen test, which is great for maybe if you have mild symptoms or you are not symptomatic, but you're trying to determine if maybe as a close contact if you might be asymptomatic. So that's antigen testing. It's a quick little nasal swab, and it takes about 15 minutes. And it's pretty effective at letting us know if you might need to have further testing because you might be carrying COVID positive. And we also have PCR testing. That takes about 30 minutes. It requires a nasal swab that goes into a little cartridge that's then read by either an iPhone or an iPad. And that's best for somebody that might be symptomatic. So we ask that you make an appointment. Don't just show up at the school asking for a test, but make an appointment. And if we have a spot, we definitely want to accommodate you. Right now, while we're ramping up our testing capabilities, we might not be able to accommodate you on the day that you contact us. We might have to ask you to make an appointment for the next day or even another day out, at which point you might decide that it's better to find some of the resources in the community. And we have a lot of those available and linked on our website as well. And many of the community resources are finding that they can turn things around in 48 to 72 hours. So we want to help you, but we also want you to know you have other resources. All testing requires parental consent. We will not be testing any students without your prior consent and information. So if a student comes to the nurse and they're presenting with some symptoms and the school nurse thinks that this would be a good opportunity to offer testing, they would offer that testing to you as the parent, make sure that you've given consent, and then they could give that test. And you might know something before you even come to pick up your child for the day to find out whether they can return because it's a cold and it's not COVID related, and so in a couple days they can return to school, or maybe they need to stay out for a full 10 days and get fully recovered. Anything you want to say about antigen testing or like that?
As Kate said, it's one of our greatest resources to keep schools open. So we are really going to rely on our testing capabilities to ensure that in-person learning continues for our students. I'd like to talk a little bit about students with symptoms. If a student does develop symptoms from COVID-19 while in school, that child will be sent home. You'll be contacted by the nurse or the administration at the school to come pick up your child. Sick children will be separated from symptom-free children. We have isolation areas in all of our schools to ensure the safety of our students and staff. And then students really will need to follow the readmittance to school wellness check that Kate's going to go over here in just a minute. And a portion of that is testing to come back into school. And so we're partnering with parents to ensure that they're going through the wellness check on a daily basis to keep our schools symptom-free.
Okay, so this is our wellness check. This is for staff and students. And again, the first thing, and you'll hear this from medical advisors and from everybody, is to stay home if you or your child has any symptoms that could be related to COVID-19. And testing, rapid testing, provides us that opportunity to determine if this illness is COVID related or is not COVID related. So we really encourage testing. But if you choose not to test, that is your right, but we would then have your child stay out. We kind of have to assume that it's COVID related unless we can prove that it's not. So they would have to stay out for the full 10 days. If they get tested and are either determined to be COVID related, COVID positive, then of course then there's that duration of time that they need to stay out until they're fully recovered, usually a minimum of 10 days, and then whatever it takes for them to be over their symptoms. if they get tested and it's not COVID related, maybe it's strep throat, maybe it's a cold, maybe it's allergies, and it's not COVID related, then they can come back when their symptoms are resolved and improving and they no longer have a fever or any of the symptoms like vomiting or diarrhea that would keep them out of school anyway. So that's what to do if you have symptoms. If you're a close contact, and we are identifying students and staff as close contacts in cooperation with public health. So where we can maybe identify a student based on the seating chart as a close contact or staff members as close contact, and then maybe public health follows up on who had a slumber party or who goes to karate together or who has other carpool activities. So it's a partnership. So when we can identify and tell families that there's a close contact in the school setting, we will tell you that. And then we do require that person to stay out for the full duration. That requires a 10-day absence from school and activities and potentially for work for staff members. But it can be shortened by testing after day 5. So you could test on day 6 or 7. And if you get a negative test on day 6 or 7, you can return on day 8. This is all assuming that you stay symptom-free and nothing develops. If you're out on close contact and symptoms develop, then you need to get tested to see what that is. So again, there's lots of little scenarios with that. I encourage you to follow the wellness check and to be in touch with your school nurse or public health, or contact your administrator for some help on those. Again, we offer this testing as a resource and we hope that you're able to use it.
So now we'd like to talk a little bit about positive cases. If your student does become positive while they're in or out of school, that student will need to isolate as per CDC guidelines. We really want to ensure that our schools are symptom-free, and isolating our students and ensuring that they don't come back into the school after a positive case is a way to do that. Families are encouraged to call the school if there's a positive case with their student or family. That helps our school and our staff work with public health to do contact tracing and to ensure that the transmission is broken within the school if there is any transmission there. That's a really critical piece in ensuring that transmission is not taking place within our schools. Schools will also do their best to inform families and students that may have been exposed or that there may have been a positive case in a classroom. There'll be 2 general notifications that go out. One will be a general notification to the classroom or group saying that there may have been a possible exposure within that setting. And then the second notification will be much more pointed for those that are identified as close contacts. So if you are identified or your student's identified as a close contact, then school administration will be following up specifically to let you know that you are a close contact. As we've talked about, contact tracing is an essential part of keeping our schools safe. We're working in conjunction with public health to do contact tracing. All of our classrooms are encouraged to have seating charts, and as positive cases arise, our principals will work with teachers and classrooms to identify close contacts of those students that were close to case positive students. You could probably anticipate the school contacting you prior to public health. We have that information more readily available than they do, so the school will be reaching out if they know that your student is a positive, or a close contact based on being in school. As Assistant Superintendent LaPlante mentioned, that only extends to our school setting. So if students are close contacts because of extracurricular activities, being at church, being at other camps, then public health will come behind and let your families know that they've been a close contact due to an association with those activities. How we're defining close contacts here at the school district is close to is in line with CDC guidance. A person is considered a close contact if they've been closer than 6 feet for an accumulated time of 15 minutes or more. Now, there is an important exemption that we'd like to point out for K-12 indoor classroom settings that is specific to students. And this excludes students who were within 3 to 6 feet of a COVID positive student where two things happened, where both students were engaged in consistent and correct use of well-fitting masks. So this is where we are encouraging parents to consider masking for their students, because this can be a great mitigation tool for our students and staff. And then also where other prevention strategies are in place. So we're doing our best to socially distance students, ensuring that we have clean environments and that ventilation is proper in our schools. So some specifics around quarantine guidelines. Quarantine is required if you've been identified as a close contact. So as close contacts occur, principals and administration will reach out to your family to let them know that a close contact has possibly happened within the school. If that has occurred, your student needs to stay home for 10 days after your last day with a case positive student, unless your family would like a testing option, and then the school can provide that for you. And that can lessen the quarantine down to 8 days. So a test would occur on day 7 or 8, and then your students could come back to school on day 8.
I think it might be helpful to point out at this time that while we have younger students who aren't eligible for the vaccine, so masking for them is definitely one of their best strategies to avoid becoming a close contact. For our older students, their families might have considered the vaccine as an option for them. That's a family choice. That's not something that the school district can make a decision on, but as a family, you might have considered that with your medical provider. And students and adults that are fully vaccinated are not required to quarantine as a close contact, and so that's a huge benefit to a student.
Yeah, thanks for pointing that out. That's definitely a game changer for our students, especially our student athletes, where teams have had positive cases. Those student athletes that are vaccinated have gotten to continue to play as long as they were symptom free. So huge benefit for our students and staff. So one thing we want to ensure that parents are aware of, that we will have a continuity of education as students are quarantined. Two main ways that this will happen and that we've encouraged schools to disseminate information is through Seesaw and Google Classroom. You're probably familiar with those tools, as many of our classrooms and schools use those tools last year to conduct online learning. Seesaw is specifically for K-2 students, and so those teachers that have chosen to use Seesaw will provide work there, worksheets, different assignments for students to complete on Seesaw so that education can continue as students are quarantined. Similarly, there's a tool called Google Classroom for our 3rd through 12th grade students, and we're encouraging our 3rd through 12th grade teachers to utilize that tool so that a continuity of education can continue and that students can continue to learn while they're at home.
So I'm going to introduce level 3, which is modified operations. And if you'll notice in our visual here, level 1 and level 2 kind of wrap around the school district most of the way, almost all the time. And level 3 is something that gets layered on top as needed. And so level 3 would be for those times when we have known transmission within a class, team, group, or school community. And again, this could be a classroom at a school or a couple classrooms, or it could be a school team where we feel like, gosh, the transmission might be happening in that setting and we want to break that transmission cycle and not contribute to that perpetuating it. So the protocol provides an opportunity for individuals to continue participating in school as long as they adhere to some of the expectations that we put in place. So families would have a choice to follow the Heightened protection protocol or to keep their students home during this modified operation. So what we would do during this time is we would heighten our surveillance testing. So that testing would happen on the first day and then every 3 days for a duration of 10 days. We would ask the students to wear a mask and the staff to wear a mask in that particular setting, whether that was a class or a group of students or a team. And everybody would have to remain symptom-free. So if on day 2 or 3 somebody developed symptoms, they would have to begin their isolation, or if they tested positive at any time, they would have to begin isolation. What this would do is allow us to continue with in-person learning options, but allow the to try to break that transmission cycle so that it doesn't spread to more of the community, more of the school, and we can maintain in-person school. This is something that we didn't have the capacity to do last year because we didn't have such testing capabilities, but we're very hopeful that with full testing capabilities and the cooperation of our medical advisory team, we've put together a protocol that can keep in-person school open for students in a heightened protection protocol. Occasionally, there might be times where we need to go a little bit beyond that, and either for, again, to try to break that transmission cycle, or because maybe we have so many staff or students that are not able to come to school and it's changed the ability to maintain in-person school at that location, we might have to have short durations, I say short, that would be the hope, durations of actual school closures. And again, our hope is that we could do this maybe at a very localized level, closing a single school for a specific duration instead of having to close the entire district. We actually did do this a little bit last year where we had specific reasons to close specific schools. And usually that did exactly what we needed it to do. Is it stopped the transmission happening within that setting and got us back to more of a normal controlled situation, and then we were able to resume school. Under those particular circumstances, students would rejoin hybrid teaching. They would go online fully for their education at that time. So I'm going to have maybe Luke talk a little bit about the continuity of education at that particular time.
Yeah, so during a campus closure, there will be live classes. So staff members will report to buildings, and then they will deliver live synchronous lessons on either Google Meet or Zoom, similar to what we did last year. It's also important to maintain nutritional services. We have an amazing nutritional services team, and I'd like to give a big shout out to them. They've already been doing amazing work this year as well as in past years to keep our students fed. And that will continue through a school closure. So be on the lookout for information from your school if that does happen. Nutritional services will either deliver or have food available at that school or a nearby school depending on availability of services.
So again, we've built all of this with the understanding that we're partnering with you, the parents and families in our community, to keep kids able to come to school and learning, and that also means that we need you to keep your students home if they are experiencing any symptoms, or if they're awaiting the test results because they think that they're a close contact to somebody in the family, or somebody else in the family has just recently tested positive and now they're getting tested. So it's really important to keep students home if you're awaiting a test for those reasons. And we appreciate everybody that's reporting positive cases to the school so that we can effectively do the contact tracing component. And also we're standing up a new dashboard where we are reporting positive cases that are reported to us, and families can see that information on the school district website. We again want to remind families that there are parts of the tools that we have that are purely a family choice, and that includes masking and vaccinations, and of course keeping your child home if they're sick. So those are things that we ask for your partnership with, and we are asking our staff to do the same thing. We're doing the same thing. I had to make some difficult decisions this year when I got a cold and make sure that I stayed home and got tested, but it's better to know than to expose my colleagues to that illness. That concludes what we have to share with you today. I know that there's probably a place where you're able to put comments and questions. We have a team that's capturing your notes and your comments, and we also want to remind you that we have the tool Let's Talk. So if you have additional questions that you want to submit to our district, please go forward and put those into Let's Talk, and we will make sure to bring those into consideration, try to get answers out to people, and see you for the next updates. So thank you so much for spending some time with us this afternoon.